learned a little bit about IQity.
Yes.
And we set out with IQity because we see there's a lot of stress in ophthalmology right now. Reimbursements are going down, costs are going up, staff costs are going up.
That's right.
There's a shortage. We have a shortage of ophthalmologists that will grow.
That's right.
In your point of view, how will technology help address those problems?
Well, I think we really have to look at efficiency and decreasing, let's say, staff labor. If that's one of our biggest costs. It's not only the actual cost of the staff itself, but training individuals. The turnover. You get somebody up and trained and then they leave, or even if you can afford them, then they might leave. So if we can reduce the staff burden and basically increase efficiency of what we need to do, so we can have better tools or sort of leverage technology to make those improvements, I think the whole field will move forward.
You are very well known for adapting new technologies really quickly. What does that process look like for you? Like, how are you evaluating new technologies? How do you decide to adopt something new?
Yeah, so usually for me, there's kind of three kind of main buckets. Two most important are safety and efficacy. If you can hit on safety and efficacy, I think that's moving the field forward. So if you can have something that allows you to deliver an outcome at a better point, that's efficacy, safety to decrease the complications, allow for just more or less a safer profile. And then you have other things, efficiency, that's not as critical as safety and efficacy, but if you can become more efficient, that's a step forward. And the third, I'd like to say that it's not part of it, but the reality it is marketability. So if you have something, maybe safety is a neutral, efficacy is a neutral, efficiency is a neutral, but if you can market it, then it's going to bring patients into your doors. That's sort of the fourth pillar of what drives innovation.
One of new technologies that I think you're also very well known for are 3D microscopes, right?
Yes.
And digital microscopes.
Sure.
Can you share a bit about the advantages and the disadvantages that you have lived through so far?
Yeah. So I guess you could add on to that longevity. I'm in this for the long haul, and I've realized traditionally, if I'm going to do 20, 30, or 40 cases in a day, and be comfortable and go home and be with my family, be a productive individual outside the OR, I need to be comfortable doing what I need to do, and heads up. 3D heads up has really been a step forward in that. And we've come a long way. I mean, 3D heads up is great, but it's not perfect. There are some sort of shortfalls with the current system. So if we can improve upon that, allowing for better ergonomics, giving that doctor maybe longevity for that individual day, but also for a career. I've seen so many doctors sort of just bow out. When I was in residency, I think we had 6 attendings that ended up needing back surgery just the time that I was in residency. So I myself, I don't want to go through back surgery if I can avoid it. So if I can have something that gives me longevity in years, but also longevity in the individual day to allow me to be more productive in a day, I think that's a step forward.
You mentioned staff shortages, right? And the difficulties of hiring staff, keeping staff. I think one of the technologies or one of the themes that we see also on the exhibition floor is automation.
Yes.
Right? Where do you see right now hurdles for automation? Like, what would be hindering you from automating more in your practice?
Well, I think one of the pillars for automation is you have to have data. You have to have diagnostic collection of just the visual information. So you need the diagnostics for the eye exam. You need the diagnostics during surgery, because before you can automate a surgical procedure or even a diagnostic exam, you really have to gather that data. So gather the full eye, the picture of the whole eye, and translate that maybe into the operating room. And so those two things, you need diagnostics that can really look at the whole eye, that allows you to automate. We know automation and technology is coming, but right now we have to make sure we just gather the data so we can apply it to that future world where automation truly is going to happen.
Thinking about workflow, right? We mentioned staff shortages.
Yeah.
Is there any other bottleneck right now that's kind of, it's bothering you in your clinic where you feel like the workflow is not fully there yet?
So I think we see workflow issues in two ways. Number one, in the actual operating room, how do we become more efficient? Just having the patients move through the system on the operating day, but maintain their comfort throughout the day. There's that, but also workflow in the office, in the lane. Right now, that, traditionally, moving a patient from 4 different diagnostics and then to the slit lamp, and then, having maybe an optometrist see the patient and then a surgeon see the patient. All that is extra steps that, more or less erode efficiency throughout the day. So if we can increase the clinic and or the OR, that's a step forward as well.
Now you've just seen how the IQ meter, our biometer / OCT, how that also connects with the IQ universe that lets data flow into the operating room, right? Which basically describes, making away with that bottleneck.
Yes.
What impact will that have for you in your practice?
Well, I think it allows for efficiency on that day of surgery, but I think allows for the potential of automation and allows for a faster and more thought out throughput on that surgical day.
You've been part of IQity for quite some time.
Yes.
IQity's mission is to develop technologies that both enable better clinical outcomes, as well as saving time and money. What about that resonates most with you?
Well, I think unfortunately, healthcare today is under a tremendous amount of pressure, where margins are being eroded, costs are going up, reimbursements are going down, and so the only way to adapt new technologies is got to solve, one of those 2 things. And I think IQity can touch on a number of different ways, the whole system, to more or less help counterbalance that, increased cost or decreased reimbursement.